healthcare, I'll tell you a little bit about the reason we started this company and how did we get into blockchain. I've been in healthcare all my life from the administrative side. I've been part of the executive team of a company called WebMD, and then also part of the insurance business as a CIO of a major insurance called Blue Cross Blue Shield, Meridian Mutual. So I got into healthcare when I was 19. I was an intern at a healthcare insurance company. They didn't know what to do with me, so they stuck me in the mailroom and said, go figure out how mail works. And over the next 20 years, I worked my way through the organization and I ended up as their chief information officer. So it's a true mailroom to boardroom story. But what's really important is that I learned everything about how healthcare benefits are managed in the US and along the way in Canada and China and Japan and India and so on. And the journey continued, and I was pretty happy with what we were doing till about a few years ago when my son was born with a lot of disabilities and cognitive challenges. And despite having every major healthcare CEO on tap on my cell phone, it was a full-time and still is a full-time job trying to manage his care. And that made me stop and ask the question that I've overseen billions and billions of dollars in IT spend over my career. And here I am unable to coordinate the care of a 3-year-old. What's wrong with our system? And we are overseeing $1 trillion a year in spend on these specific diseases, and here we are again without really any measurable impact. So it's a combination of a professional and personal journey that caused me to stop, get off the corporate perch, and start Solve.Care. So that's the genesis of the company. What we are doing is using blockchain in some very creative ways. We are a company of many firsts. We were the first company to call out that the real use of blockchain is not in medical record storage, even though that's a good use case. That's not really the use case that will change consumer experience. We focused on administrative, clinical, and financial side of healthcare. So we really went after the plumbing and why healthcare doesn't seem to ever work the way we would expect it to work when we are a patient, or when our kids are a patient, or when our parents are a patient. There's too much friction, too many barriers to usage, and too many there's too much opacity in the process. So we are focused on the patient, doctor, insurer, employer relationship and redefining that using the blockchain. So what we don't do is store medical records. That is not really a good use of what our vision is. What we are after is the collaboration and timely access to care between doctor-patient in a scenario where somebody else is paying the bill. Whether you are a government agency or NHS in the UK or Central Health Authority in Canada or the Medicaid operation in US, doesn't really matter. It's about effective coordination of care between people. So in effect, we are trying to replace system-to-system interaction with person-to-person interaction that protects the security and the privacy and the efficiency of healthcare system. We are after the synchronization, shared information, secure way to transact, verifiability of every healthcare transaction that took place between people, the immutability of that transaction, forever, so we can always go back and check how I was treated 3 years ago by a variety of doctors and specialists, and most importantly, enforcement, both by compliance, regulatory, and care coordination and care quality perspective. So what we designed is we built a complete healthcare operating system on blockchain. We've been at this for years. This is not something new. And the idea of this blockchain-based operating system is to build a multi-tier solution that every single healthcare jurisdiction can use. Although we are very heavy in the US healthcare space and we have a live system being used to transact payments between insurance and doctors today, our vision is much broader than that. We want to be the Salesforce.com of healthcare using a DLT model in every jurisdiction in the world. And that is truly our goal. We don't say that to impress people. We just believe that every human, man, child, and woman deserves to have better healthcare than we have today, regardless of what country you live in. The way the system is engineered at a very high level is in the hands of every stakeholder is a care wallet, which is personalized to your needs. If I'm a patient or a doctor or a pharmacist, an ambulance driver, or a care coordinator, or a social worker, or a suicide prevention hotline worker, I have a care wallet either in my phone or on the desktop. that allows me to perform very specific role functions in the form of care cards. Care cards are D-apps which are published into my wallet based on my conditions and needs. So a simple example is if I am diagnosed with diabetes tomorrow, I will receive in my wallet from my employer or my physician or from my government a diabetic care management card that helps me manage prescriptions and disease conditions and care events that lead to a better result of my treatment. So we are after enablement and empowerment of the patient. Attached to the care card are care coins, which are essentially a network currency that give me the financial incentive and financial transaction capability. So my employer can issue care coins for being a good employee in terms of lower absenteeism. My insurance company can give me coins to pay for the doctor when I go visit them, thereby eliminating the need for a third-party benefit organization. All of that is sitting on top of a care protocol, which allows you to map relationships. The way a patient-provider relationship works in China is a little bit different than how it works in California. So the idea is that the platform lets you define the stakeholder relationships according to the regulatory compliance of healthcare in Malta versus Mongolia. So that's the objective here. We don't store data, clinical data on the chain, so we have off-chain storage called Care Vault, which lets you connect to your electronic medical record systems and your practice management system, eligibility system, enrollment system. There are more systems than there are human beings on the planet, and you need to connect to those systems. So the vault is a mechanism through which we can exchange data with legacy systems. What that leads to, this model of care wallets that connect to each other and care cards that we can exchange with each other on a chain, is a patient-centric ecosystem. Now, none of us wake up in the morning and say, I'm going to be a great patient today. That's the purpose of my life. I don't think any of us live to be a patient. But when you become a patient, or someone in our life becomes a patient, immediately an ecosystem is formed around that patient. Who is the doctor? Who's the specialist? Who's the nurse? Who's the pharmacist? Who is the lab? Who's doing the test? Who is the moderator, the coordinator, and who's going to write the check, me or somebody else? That ecosystem evolves around a patient for a specific need, exists for a while, and then it disappears. Because if you look at a happy situation where someone in your family is pregnant, you're going to have a 9-month-long journey to manage that very happy condition. But you're going to have a lot of people come in and out of that process. And then at some point, that ecosystem doesn't need to exist anymore because everything went fine, the baby's here, and we can move to a different kind of a model. So this is a instantly sprung patient-centric network that allows specific wallets to collaborate, interact, transact, manage, and then disengage. But the past engagement stays on the chain forever. So we can always go back and see if things were done during prenatal care or postpartum care that led to a child having certain difficulties in life, and we can manage them. That doesn't mean we have to share all private information about the patient, but we can definitely track things like incidence of chronic diseases or avoidable suffering, as we call it. So this is the end result of the platform that we talk about. Before we go any further, this is not a theory that we are talking about. We have launched a platform in the US, which is the most regulated healthcare space in the world, in Arizona for 5,500 physician network that takes care of about 250,000 American citizens. And that's a single client of ours. So they sponsor the network to deliver care. I'm not speaking close enough. I always do that. So what happens is that we take a specific care delivery model. So currently we are building a cancer treatment model for patients over 55 who are either at risk or have been diagnosed with cancer. And in that model, we will have an oncologist, a lab, a physician, and perhaps family members working together to protect the patient from either developing or dealing with post-cancer treatment. And in that ecosystem, certain relationships are important, and those are defined in the protocol, and the platform is launched for a specific set of wallets. And once those wallets are actively used, all transactions are analyzed by a set of physicians who are monitoring my care or a group of physicians, a group of patients. We are similarly launching a diabetic care program for those who have diabetes and a heart condition, so they are at a very high risk of strokes and death by stroke. Avoiding that is a huge human progress in terms of, we know that over 55, those who have cardiovascular disease and type 2 diabetes are at much higher risk of heart attack or heart stroke which in most cases can be prevented if you can monitor certain symptoms. So these are the type of programs we are launching, and one of the most exciting ones is clinical depression leading to suicide. And monitoring certain conditions in patients voluntarily supplied, rewarded for supplying that information, where we can monitor for trends that lead to potentially a clinical depression, which leads to all kinds of very poor outcomes. Some of the examples of use cases that we have implemented in the US and now we're bringing to the rest of the world are Uber model of appointments. So instead of me finding a doctor by dialing for dollars and searching for a doctor who will see my son on a Tuesday afternoon, I can put a request through a care card on the chain, and every certified wallet, that is a pediatric wallet, can automatically receive the request for when I want to bring in my son for treatment, as opposed to finding the doctor who will see me at the most inconvenient time. So in this model of appointments, this is the reverse model, it's a demand-based scheduling. But what's really important about the chain is that if I do cancel the appointment, which happens a lot, then that slot becomes immediately available for somebody else to take. So physician's time is not wasted, and I am required to pay tokens at the point of appointment, so if I don't show up, there is a certain compensation built in for the physician. Otherwise, the physician is the one who's taking all the risk. This changes the way healthcare is accessed. In public programs in the US like Medicaid, doctors don't want to give appointments to Medicaid patients because 4 out of 10 won't show up. So why would you give your time slot, which is money, to someone who's likely 40% of the time not to show up? That creates huge access problems. Medicaid patients don't get to see doctors as they should because doctors don't want to see them because they don't show up. So in that model, having a demand-based appointment model where we can fill the slot immediately gives the provider a lot more comfort that they can actually see the patient and not lose revenue. Another big use case is eligibility, proving that I have insurance, making sure that you as a physician have a guarantee of payment. So instead of today, the doctor calling the insurance company to confirm that you have the insurance and trying to figure out how much they should bill you and the insurance company, we can issue a digitally signed card by the insurer, which guarantees real-time payment to the physician. I show up at the doctor's office with my wallet, our wallets sync, immediately tokens are transferred to the wallet of the physician, guaranteeing absolute and accurate, timely payment. Typical payment cycle in healthcare today is 90 plus days, which means I go see the doctor, they get paid 90 days later from the insurer. Not a great incentive to see me as a patient. Eliminating the 90-day cycle is a huge factor in healthcare. So the general concept here is that because these wallets can stay in sync on the chain using the underlying blockchain as a DLT event ledger, whenever an event occurs between a doctor and a patient, the insurer or the employer, as appropriate, can be notified of those events. So simple use case here. Let's say that you're a single mother and you work for a company and you have now an appointment with a physician and that requires you to take 4 hours off from work. The company has two choices. Choice one, they give you a day off and hope you go see the doctor. Choice B is they can say, no, we're not sure that you're gonna go to the doctor, sorry, you can't take the day off, resulting in missed care. Both scenarios are bad. You're losing too much time or you're denying care to a patient that really needs it. What we do in this scenario, there are three wallets: patient, doctor, and employer wallet. When the patient makes a certified appointment request and the doctor accepts it, the employer automatically gets a time off request from the physician certified saying, yes, Jane is going to come see me Tuesday at 11 a.m. Therefore, I as an employer have perfect reason to give her the time off, but I'm giving her 2 hours off or 4 hours off, not full day, because she can leave at 10, get there at 11, come back at 12, and be in the office back by 1 o'clock. That changes the way employers see absenteeism in healthcare access. And we take it one step forward. Let me jump to this one. If I'm really a conscientious employer, I can not only give Jane time off because I want her child to be born healthy, I will also give her a card in her wallet that I'm paying for Lyft or Uber or Taxify to pick her up from the office, take her to the doctor, bring her back, and I know she's not going to go shopping or roaming in the park because I'm actually paying for her transportation and I'm paying for her speedy return. When you do the computation of the cost of ride versus missed 4 hours of work, every employer in most cases is willing to sponsor that ride. We are trying to change the way people consume healthcare by bringing all the parties into sync and reducing the barriers to access, which are either time, money, or availability. time, affordability of healthcare, time it takes to consume healthcare, and the cost of healthcare are the three big areas we're going after. We also have a care continuity use case where when I break my arm, I go to the doctor, they put me in a cast, and they give me certain conditions to follow. Come back 6 weeks later, my arm is completely at an angle. What the hell happened, Pradeep? What did you do? Well, we don't know. Now it's too late, we gotta do surgery. Avoidable issue. What we can do is we can issue a care continuity card as a physician to my wallet, which I can issue to all the family members and caretakers of this person. And that requires you to report certain symptoms like itching or swelling, or in this case, extraordinary pain, or a strange angle at which you're sleeping. And that allows me as a physician to intervene before my condition degenerates to a point of no return. Very useful in things like cancer, diabetes, again, clinical depression, in terms of joint and knee replacement, and so on and so forth. Dozens of use cases. Last but not the least, in the US and growingly around the world, the Middle East and US and Asia, there is a movement away from paying the doctor for visits. There's a movement towards paying the doctor for getting you well. I will pay you $50 if you see Pradeep, but I'll pay you $100 if you get him out of the hospital 3 days faster. That's called value-based payments. We'll pay you to keep him healthy and get him well better than to pay you for repeat office visits and hospital stay. Value-based care was sponsored by President Obama as part of the Obamacare. It's called accountable care. And I was very lucky to be part of that whole team that was implementing that in the United States. But it really doesn't go far enough because it still relies upon physician doing all the calculating and the reporting. In our system, we've designed it such that the patient, the physician, the employer, the family member, the caretaker, even third-party independent entities can evaluate, is the doctor doing a good job? Is he just prolonging my illness, or is he actually getting me well faster? And if you think about episodes that really drive cost of care up, those are primarily around chronic disease and missed care opportunities. We all know prevention costs far less than treatment. So this is a model where we can actually ensure that diabetic care or pregnancy care or trauma care truly follows best care practices called evidence medicine. Last but not the least is payments. So our platform and every other blockchain solution in the world is trying to streamline and accelerate payments. So the objective here is to attach payments to events. We can pay you instantly if certain events happen. We won't pay you if certain events don't happen. If an appointment was made and an appointment was not confirmed, you're not getting paid a claim. But if I show up and an appointment is confirmed, a prescription is written, we'll pay you instantly. Now, keep things in mind that in many countries, the cost of payment sometimes exceeds the payment itself. I was in charge of our payment system at the Blue Cross I mentioned, and our cost of paying a claim was about $35. Now, if you send me a $25 claim, a bill, I would spend $35 to pay the $25 bill. That's insane, but that's normal. So in this model, the $25 bill cost me 25 cents to pay, not $35 to pay. So we're trying to eliminate a tremendous amount of cost and overhead in healthcare, particularly in the US, and also in centralized healthcare systems like NHS and Canada. Quick summary here. So our provider wallets are in use currently in Arizona by a network of about 5,500 physicians. About half of the eligible providers have signed up. The other half are in the process of signing up. We expect near 100% adoption. Our consumer wallet for about 250,000 patients is going live in the next 30 days. That allows them to interact with the providers. And then we are introducing a client wallet, which will allow them to publish even more care cards and even more complex programs through under their own strength in the end of this year. Our first major client is Arizona Care Network. This is an important client for us because they are owned by one of the largest healthcare systems in the US. Arizona Care Network is what is called an accountable care organization. They are paid to make sure the patient gets well as fast as possible. Insurance companies hire them to manage your health so you don't get sick, and if you do get sick, you get well as fast as possible. They are owned by the Dignity Health Systems, which is one of the largest hospital chains in the US, as well as by Tenet Health Systems, the second and third largest healthcare systems in the US. What we are here for in Malta is not raising funds or doing an ICO. We are here in Malta looking for healthcare partners who have credible healthcare solutions, be it around cancer or any disease or in any specific pharmaceutical or other care management capabilities that we can bring into our ecosystem and launch in different jurisdictions. We are currently launching the platform in Middle East, we're launching it in Asia and Northern Africa, and we're always looking for creative organizations that want to change the way healthcare works. Because our first mission is to reduce human suffering, and second mission is to reduce cost of healthcare, and third mission is to make sure that we build a sustainable ecosystem where those who publish value get paid fairly for it. So our model of the ecosystem is like App Store. If we have a creative solution for healthcare, medical tourism, teleconsult, nurse line, disease management, we would introduce your solution into the platform as yet another care card for a specific population. So with that, I'm going to stop talking and see if you guys have any questions. And I do appreciate everyone coming and sitting in a rather hot room and listening to me talk about healthcare.
Thank you.
Any questions? Please.
What blockchain do you use for your platform?
So we are using Ethereum Enterprise as the chain today, and we have the mainnet, which is Solve.Care net, and then we have the insurance company specific chain that connects to the mainnet. Any other? Yes?
Sorry, I missed, are you live?
Yes. We went live in July, and then we launched a second version in October. So we have a network of physicians in the US that are currently using it for receiving all their value-based payments, as well as for managing the certain specific disease conditions based on the ADA guidelines and so on. So two goals. One is to pay the physician quickly. Second is to pay them for getting you well back faster, rather than just paying you to show up. So those two are.
And the patients, do they use the app as well?
No, the patient app goes live later this month.
Oh, okay, goes
Right.
live later on.
Yeah, today the providers use the wallet to get paid from the insurance company in the form of a digital token that they can redeem as they see fit. And the patient appointment capabilities are still in beta test, and that comes up next.
So are you using tokens on your platform?
Yes, so our client issues their own token on our platform to pay the doctors. So an insurance company, instead of writing a check or an ACH or EFT, or telling the doctor the check's in the mail, they actually pay them in real time in the digital currency that they issue.
I see. So you don't have to deal with the regulatory framework of tokens?
Yes, because these are essentially payment vouchers, right? So there is no volatility to them. They are fixed value, guaranteed redemption, backed by insurance company reserves.
Right. Thank you.
Yes. Any other questions? Again, I invite you all to come visit us. I would love to hear how you might see a use case on our platform that will help you. We are all healthcare consumers. I know that we are born into healthcare and we die in the arms of healthcare. It touches every one of us. And to me, it's very personal, but I think it's personal for every one of you. And to us, the mission really is to make incremental improvements, one disease, one group at a time. And that's really what the journey is. And we're very excited and very proud and very humbled by the adoption we are seeing. This is not we'll build it and hope they'll come. This is rather, we're building it because our clients are demanding solutions right now. And that's what our platform is delivering. Thanks again. Appreciate your time.